Hello, this is Dr. Stephen Evans with Outclick Magazine. Today we have a special edition talking about medicine and healthcare. For those of you that don't know, I actually worked in medical education prior to starting the magazine. For 10 years, I was a curriculum consultant at the University of Kentucky College of Medicine, an absolutely wonderful place that gave spectacular education to our medical students. For 4 years, I worked at another wonderful institution, the Florida International University College of Medicine, where I was the director of clinical education and helped them get their accreditation through the AAMC, the American Association of Medical Colleges, and the LCME, the Liaison Committee for Medical Education. My PhD is from the College of Education, from the University of Kentucky in Educational Policy Studies and Evaluation. My dissertation is how third-year medical students come to understand patient-centered medicine during their pediatrics clerkship rotation. Today, we're very excited to welcome Dr. Frank Vittimberga, who is the physician advisor at Florida Medical Center, a portion of Tenet Health here in Fort Lauderdale, Florida. He has a BA in biology from Harvard University, an MBA from the University of Massachusetts Amherst, and also his MD from the University of Massachusetts Medical School. Frank, welcome to the program today.
Oh, thank you for having us.
Thank you. Thank you. We've worked with Florida Medical Center, and we're very excited to talk to you today. We know how committed you are to patient care and healthcare and to the patients that walk through your door. We are very excited to talk to you. Tell us a little bit about Florida Medical Center and what goes on out there for your patients.
So Florida Medical Center has been in existence since the early 1970s, has really had been in Broward County. It was the first hospital in South Florida to do cardiac bypass surgery and really has a long tradition in open heart surgery and cardiac issues, as well as neurological issues. We're a comprehensive stroke center, and we have a complete service line of neurointervention, as well as neurosurgery cases. And so really a full service hospital, and we're at Oakland Park in the Turnpike, so a little bit kind of centrally located in Broward, which really gives us a very diverse patient population.
Okay. And then you have also, in addition to that, you have your regular outpatient services as well for people?
Yes, we do. So we have, people that will routinely will come in for radiology or other exams. We do a lot of elective surgery.
Okay.
Program in bariatric surgery for weight loss reduction, elective type of procedures, and a big orthopedic program as well, a large total joint program for knees and hips, and as well as other orthopedic issues. A lot of sports medicine doctors that are here and provide care.
Okay, I'm going to pull up your website. You have a lot of very great services. We've worked with you a lot on so much of your great content. Are there any special services we should look at today? Of course, the emergency room right now is one of the big ones where you've seen so many COVID cases. I know your ER care has ramped up its services quite a bit.
Yeah, we have. It's initially we had a surge, with the COVID cases in March, and then things kind of calmed. We've seen another resurgence, and I think the biggest thing about the ER is we're going to have the COVID cases. COVID's going to be around for a while. At the same time, I don't think we can neglect the rest of the health issues that people have. I think, when we thought it was going to be a week or two that we were going to be, waiting around for this to pass, then you could kind of put off those doctor's appointments or coming to the doctor, the emergency room if you were having issues. But now where it looks like we're kind of in a more prolonged phase, it's important that people don't neglect their healthcare issues and making sure that they, chronic issues like their blood sugar and their blood pressure, making sure that those are monitored so that they don't end up ending up in the emergency room. At the same time, I think there's some reticence of people to come to the emergency room at this point because they don't want to be exposed to COVID. And that being said, the CDC saw an uptick in terms of a decrease in terms of patients presenting with heart attacks, strokes, controlled diabetic hypoglycemia. So it really, we're seeing that there's people that are avoiding those, and presumably, heart attacks and strokes haven't taken vacation. So we just want to make sure that people feel comfortable coming in to the hospital, and we've really, take that seriously. We think we know a lot more now than we did back at the beginning of the year in terms of COVID spreads, how to protect patients, how to, have the workflow. And also we have a lot more testing available so that we're able to facilitate, get people rapidly tested and get, kind of identify people that are possibly have had exposure to COVID or possibly are infected, and making sure that we kind of provide services and minimize the risk to any other patients that are at the hospital.
And you made a good point. I'd heard that several times, that people who had other problems or issues were not going to the emergency room because they were afraid, not just yours, but in general, were afraid of going to the ER, and they were not taking care of their problems, not getting treated because of the fear of COVID. But the emergency rooms are very equipped to protect those people. People need to take care of their issues, need to go be seen for those underlying issues, those other issues. It's very important to go on and see and be seen by a physician for those issues. Would you?
Right. Oh, no, I totally agree. I think we've got to identify those patients and make sure that, that we keep patients that are coming in with other issues separate. And, we try to triage patients in areas where they will have minimal exposure. And, as I said, I think we know a lot more about how COVID spread. We take more precautions. Our staff are better equipped in terms of being prepared in terms of what they need in terms of PPE and personal protective equipment. And so that was really an issue back when we, at the beginning of March, when we first started into the COVID, was the concern about running out of this equipment and the mask and gowns and those sorts of devices that we need to take care of patients on a regular basis. We've gotten to the point where we have a very solid supply chain for that, and it's not much of an issue. I think, right now, the bigger issue is just making sure we have enough ICU beds, making sure we have enough regular beds to manage patients at the time, at this time. And we said we still have wings and units in our hospital that are set aside for non-COVID patients, and we really keep those areas free of patients that are.
Yeah. In the beginning, it was very much a supply chain issue, as you were saying, with the masks and all of the supplies. It hit so hard. But it seems like that's all been caught up for a lot of the healthcare providers have been able to get the supplies that they need, the masks, because it hit everyone so hard so quickly.
Yeah, I think so. I think there was a big surge, and just like the toilet paper issues we had with
the toilet paper issues,
there was some of that with with the PPE equipment, but at the same time, we're fortunate to work for a national company that's was very proactive in obtaining those supplies, and so those issues haven't been as really a problem for us, and certainly. We want to continue doing all the necessary procedures, and again, elective cases if that makes sense in the environment, based on the patient load and based on the risk of waiting for some of these procedures that people have. As I said, it's one thing if it was going to be a week or two that we need to wait, but once we start waiting months, then we have to balance the risks of some of these more chronic, although not emergent issues, but balance them with the risks of the stress to the system.
Sure. And a lot of our LGBT population is aging, and you have special services for seniors, it looks like.
Yes, we do. And, a lot of our population that we see, our demographics are older. We have a lot of long-term care facility patients. And so we do have, pay attention to that. In our emergency room, we have rooms that are designed more for, for elderly people that help with helping them keep track of like day and night cycles and that they're, they kind of have everything that would be available, and also take the necessary precautions, non-slip floors, making sure that, they have reduced risk of falls and making sure that they
Mm-hmm.
available to them all
Mm-hmm.
the services that they would need.
Mm. We've run some content on stroke, stroke, being able to identify strokes, and that's also very common for people to come and see you. That's not something to be taken lightly, especially with our elderly patients.
Right. Again, yeah, I think that we need to pay attention to the symptoms and be highly attuned to it. And I think the general public is getting that message that, if you see people that have weakness on one side or the other, if they have facial droop,
Mm-hmm.
that those are symptoms that are very concerning. And time is in neurology, there's an
Mm-hmm.
expression that time is brain cells. And so if you do have a stroke, it's important that you get to the hospital as soon as possible. And we
Mm-hmm.
full service, as I said, we're a comprehensive stroke center. So a full service stroke
Mm-hmm.
center. So, from clot busting medications that we give people when they come in to actually neurointerventionalists, specific doctors who go in with catheters and pull out clots out of the brain, if necessary. So those are the kind of really change somebody's outcomes. It's the difference between a devastating injury and somebody going home and going back to their regular life. So it is important, and again, as I said, there's a reticence among people to call 911 at this point, but it's important that if you have those symptoms, if you have, chest pain that just won't relent and
Mm-hmm.
those sorts of things, to get to the hospital as quick as possible.
Mm-hmm.
And again, we have a full service in terms of our cardiac services with our cath lab that's equipped with cardiologists on call to emergently take people to the lab if somebody's having an acute heart attack,
Mm.
well as cardiac surgery in those small percentage of people that can't be dealt with through non-invasive means.
Mm-hmm. And those critical moments of those, it's really critical to call someone quickly and be seen very quickly, very
Right.
quickly. Yeah.
Right. You don't want to be sitting on the TV, you sitting on the couch watching TV and waiting for the pain to go away, or
Mm-hmm.
you're kind of to get back to normal.
Mm-hmm.
It's one of those things that it's just attention to having a sense of urgency about it, and knowing that it won't get better on the couch at home, and really you need to come to the hospital.
Right. Right. A lot of our readers, most of our readers are male, and you also have urology services. I think that would be very relevant for them too.
Absolutely. I think male health is one of the areas that we really have to pay attention to. Certainly, prostate cancer is one of the more prevalent cancers that you.
Mm-hmm.
It's important to, as we get, when you're in your 20s and 30s, there's a lot less things that go wrong with us. But, as we get over 40, it's important to have regular follow-ups with the doctor, and to have, checkups with exams, and, to check your prostate serum antigen, your PSA, which is generally used as a marker of prostate cancer or benign prostatic hypertrophy.
Mm-hmm.
Being attuned to those and being health conscious is very important.
Mm-hmm. And you also have, I'm going to pull the other screen up. You also have a specialized program for LGBTQ patients. If you want to talk a little bit about that, that would be most interesting for our viewers and readers.
Sure. So we've been participating with the Healthcare Quality Index, which is through the Human Rights Campaign for a number of years. We, as I said, we really have a diverse community.
Mm-hmm.
Based on the demographics, based on culturally. We have a large population of Caribbean islanders, a large population of French Canadians. And, as we looked at all our patient populations, we realized that, we really had a large LGBTQ population that we needed to really reach out to and address their needs as well. And so we really, when we started doing the Healthcare Equality Index and a leader. This past year we were a leader, and we'll be, they're coming out with the results in the beginning of August, and we'll be a leader again in healthcare equality. Last year we were the only hospital system in Broward County to reach that designation. So what that designation does, it helped us actually look at how we're approaching our patients and our protocols and processes. And so really the leader in healthcare equality, it really looks at, do you treat your employees right, and do you have the right policies in place for your LGBTQ employees? The same thing for your patients. How do you outreach to the community and make sure that you're reaching out to address those issues? But I think it also provides a framework for all of our outreach programs in terms of how a model, how we want to relate to our patients, and we want patients to feel comfortable come in here and that we have we can address their specific needs. And I do think that there's specific needs in the LGBTQ community that in terms of healthcare, we see a higher a higher percentage of people that will have hepatitis A in that population, and it's a concern that we've seen outbreaks in Broward County for that, and so I think we want to make sure that we kind of bring attention to that. Obviously, HIV testing and prevention is important. Being able to have information available for the PrEP programs and making sure we provide that information. We've had a very close relationship with the Pride Center at Equality Park, and Robert, the CEO over there, is on our board of the hospital as well.
Okay. One of the aspects of my dissertation is on patient-centered medicine and tailoring the treatment program to the individual person, coming up with something that they will actually do based on their own lifestyle. And that's something that I'm gleaning from your program, is that coming up with a treatment program based on the person's lifestyle and something that they will actually do. That's very important when you're working with an LGBTQ patient, is coming up with a program, treatment plan, and a lifestyle that will they will actually fulfill, and something that will be better for their health care.
Right. And I think that's absolutely correct, across the board, and specifically, with the LGBTQ population. So, I think we see it with our transgender patients here, and it's an educational process. But I think it's important that people can express their gender, preferences in the way that, in ways, as long as it doesn't get in the way of their actual medical treatment, which most of it doesn't. And, being able to address people by their preferred pronouns, all those sorts of things are very important in terms of making patients feel comfortable, so they don't have to kind of hide, or not be forthcoming in terms of their history, their medical history. And, ultimately, we want to get to the point where we treat our patients the best. And I think treating patients the best is most effective when you have, thorough and open communication. And I think there has to be a sense of comfort and transparency when you do that. So, I think that's what we want to do with our patients here.
Okay. You even have a patient experience manager. You're the physician advisor for that program. It looks like you work with the Pride Center, free HIV testing through the Florida Department of Health in Broward, PrEP from Get PrEP Broward, SunServe, who provides counseling services. So you're well connected with our community.
Yeah, and we want to be able to have the resources, even if we don't provide them within our walls, we want to be able to have the resources available to refer people, when they have needs. I get calls all the time for people looking for help in terms of, where do you think I should go? And, if I don't know, I know who to ask. And that's
exactly
the most important things. And it's not really, I pick up the phone and between the the resources and the framework, the network that we've developed, we have the availability to really, reach out and find the answers. And, fortunately, I mean, we're a very good community to do that. And I think, through the services, through the county, as well as through the private enterprises like the Pride Center and SunServe, we really have a lot of resources available. But getting people hooked up and connected is sometimes the biggest, that they just don't know where to start.
And the interconnectivity and the partnerships we've learned is definitely a key to healthcare, where we can rely on each other's services and refer to each other's services. Whether it's a duplication of services or a gap in services, either one, being able to refer to each other is really a key to helping people make those connections and keep going. So that's great that you all are connected in that way. I know you all do a lot with the Pride Center. You've sponsored some of their activities, and so we see you there active all the time.
We do. As I said, we have a very good relationship with the Pride Center, and have been members of the Founders Circle for a number of years, and have sponsored a number of their events and activities. We also have a number of our doctors who will do their coffee and conversations presentations on a frequent basis. Back when when we could do that
we could do those, yeah.
Back in normal times. So I think our goal is to continue to work closely with them. As you mentioned, the senior senior care is a big issue here. The issue with the Pride Center, they just opened their senior housing, and so I think part of it, part of the issue with LGBTQ specifically related to seniors is that it's sometimes as there's aging in the LGBTQ community, some of the people that were open and out are forced, when they go into skilled nursing facilities or go into, assisted living, that they have to become more confined in terms of how open they are. And so, having those resources available where people can, kind of live their life and be themselves, particularly as they get older. And I think, this, because there was kind of a generation that was kind of didn't age to their fullest. I mean, I think we're going through some of those issues now in terms of the aging of the LGBTQ community.
So there's multiple healthcare needs that go along with that, and as our community ages. So it's great that we have you as a resource. You're located just there on Oakland Park, right past the Turnpike. Is that correct? Or on this side of the Turnpike?
Just on the east side of the Turnpike.
On the east side of the Turnpike.
Yeah, and we're just off of Oakland Park, so you have to kind of look a little bit for us, but we definitely, it's worth the drive.
It's not very far. The parking is very easy. We go out there regularly, and the parking is easy. You are taking care of people, taking all the necessary precautions as they go in for COVID, as people go in. So we appreciate that.
Yeah. So routinely for COVID testing, everybody's wearing masks. We temperature checks on everybody who comes in the building every day. Right now, we have strictly limited our visitor policy, essentially until this kind of settles down. But as the county opens up, and as South Florida, that we'll be opening up our visitor policy again, as we can do it safely. It's a tough situation because we don't have the ability to have people physically with their loved ones sometimes, and FaceTime and Skype we can arrange for, but it's very difficult sometimes, particularly with the elderly or more vulnerable populations.
It is tough, but luckily we do have the technology for people to connect in a way that they didn't have before. Yeah, absolutely. One of the last questions I always ask people is, what words of encouragement can you give people during this difficult time?
Well, I think the biggest message is that this too will pass. I was looking at pictures the other day of the Spanish flu, and it was interesting because we see back then that the people wearing masks, and you know, they were dealing with a lot of the same issues. And you know, eventually we'll get through this and get back to, you know, normal life. But you know, I think the most important thing right now is that we, you know, try and all be members of the community and do our part. Wear masks. You know, if you're sick, stay home, and just try and act responsibly. And you know, we'll get this under control.
Mm.
The other thing I would say is that there's also, you know, as I said before, we know a lot more about treating this than we did at the beginning of the year, in terms of, you know, what we, you know, we've got a lot more tools in our arsenal that we know work. The convalescent plasma, remdesivir, Decadron, you know, all these things are showing real positive effects. And so if you do come down with COVID, you know, the chances are better now that you'll get treated more effectively and you'll get better.
That's great. I wanted to share before we conclude. I think I have the right page here. We do have dedicated, what we call dedicated landing page for you all on our website. It's outclick.com/Florida Medical Center, where we have all of your content collated together. You all have really done a great job providing content for our readers, so I wanted to share that with everyone. This was really, we didn't quite get to this, but this was amazing for you all. One of your nurses, Nurse Birkin, was one of the winners, one of the 4 winners in South Florida to win a Hyundai, a brand new Hyundai. There, we were invited to be part of the media day for that. So if you wanted to speak on that a minute, it was really a fantastic day.
Oh yeah, it was exceptional and very well deserved by Birkins. You know, he was a nurse who volunteered actually to go and treat COVID patients in our COVID intensive care unit, and was unfortunately having car issues and was riding his bike to come back and forth to make it to the hospital. And so you know, he really went above and beyond, and that's somebody who, you know, I think really it's very impressive, but also indicative of the kind of people that we have here, and you know, we're very proud of him. Unfortunately, he actually is going to pursue his dream of becoming a medical doctor. So
wow,
he's going to be moving on soon, which we wish him all the best. So it's really exciting for him.
That's great. That's great. It was a fantastic day, and it was an honor for him and an honor for you all to be part of that program. So I think it was like 1,800 nominations or something huge, but it was a great honor for him and indicative of the healthcare that you all are providing.
Very good. Yeah, I agree.
Yes.
It's very impressive.
Thank you. Is there anything that we didn't cover that you wanted to cover?
The only other thing I would mention is that we're actually in the process of developing a transgender surgery reassignment program as well.
Okay.
Not sure exactly when the start date will be for that, but we've actually are kind of designing that program right now, and hopefully we'll have it up and running within the next year.
Oh, okay. Okay, amazing, amazing. I'm not for sure. There's probably not too many of those in the country, but we'll definitely keep abreast. We'll look for that for the transgender reassignment surgery program.
Very good.
Very good. We have outclick.com/Florida Medical Center is our page for you. Arthur's got that up. You are Florida Med CTR.com is your website, and then your social media as well as on the screen. So very good. Well, we thank you for joining us today. This is such a challenging time for all of healthcare. I am curious as to see how medical education handles this, because the anatomy classes where they go, the biology classes, all of those where they go and everything is so hands-on, will be a challenge, and we cannot have a shortage of physicians as a result of the colleges of medicine not producing students now and then 4 years of being a shortage. So I have a very heart for what a challenge this will be for medical education and how that enterprise is run. So I'm watching that very carefully as our physicians are being prepared for the next generation. So again, I've really enjoyed talking to you. We will look forward to additional things in the future.
Very good. Well, thank you for having me, Dr. Stephen. I really appreciate it.
Thank you. We'll talk to you soon. And if you would like more information on us, you can text OCQ to 2828. Have a good afternoon.